Hello. Are you a snowbird? Are you an RVer? Are you planning to move states in the near future and wonder how this affects your Medicare coverage? Stay tuned. My name is Billy Williams. My phone number is 800-499-1942. Our website is MedicareHealthInsuranceOptions.com. We are an independent agency that specializes in the senior market. We make these videos for individuals who may be looking for important information to help them in the decision process. Our services to you are always free. We ask you to subscribe to our channel. Please like this video, share it with your friends, and also leave any questions or comments that you might have below. Hello. Are you a snowbird? Do you have homes in more than one state? Do you spend part of the year in one area of the United States and part of the year somewhere else? Do you have an RV? Do you travel and move from state to state throughout the year? Are you thinking of making a permanent move from one state to another state, and do you wonder how this affects how your Medicare or secondary coverages might work? In this video, we're going to answer some of the common questions related to this general subject. So one of the first things to discuss is what type of coverage that you might have currently. If you are already on Medicare, do you have a Medicare Advantage, or do you have original Medicare as your main coverage and possibly have a Medicare supplement or a Medigap policy as your secondary? This makes a big difference in how you're going to approach being a snowbird or living in an RV or making a move. So let's talk about these two. So a Medicare Advantage plan is either going to be an HMO or a PPO. This is based on a geographic area, which is determined by what county that you live in at the time that you began this policy. If you have a network plan, an HMO or a PPO, and you decide to spend a part of the year in another state or a part of the year traveling throughout the United States, this is not going to be the best coverage for you, simply because if you are out of your service area, you will be covered for an emergency, but if you need non-emergency medical care, then you will be out of your network and your charges, the cost to you, will be much more expensive. So if you are considering being a snowbird or living in an RV, then having original Medicare as your main coverage is a better idea, because Medicare is a very widely accepted insurance. If you have Medicare as your main coverage, you are then allowed to receive medical care from any medical provider in the United States that accepts Medicare. If you have a Medicare supplement policy that acts as a secondary to your Medicare, then as long as the provider you're receiving care from does accept Medicare, then your Medicare supplement plan will also be accepted. So that is the first thing to consider. What type of insurance is the best in the situations that we're talking about? And if you have the option, you want to get a Medicare supplement policy. Another common question that comes up in this situation is if you have two different residences, or you are moving around from multiple locations throughout the year, what is considered the address that you list for your policy? What is considered your home state? The information regarding this is fairly clear in the contract that you signed, which is stipulated by Medicare as your home address is considered the state in which you vote and pay taxes. So it doesn't matter how long you spend in a particular area. So for example, maybe you live 4 months of the year in Indiana, you live 8 months of the year in Florida. That part of the situation doesn't matter. What matters is where you have yourself listed as paying taxes and voting. So that is considered your home state, and that will affect, in some cases, the cost of your coverage. If you have a Medicare supplement policy, the monthly cost of your Medicare supplement policy is determined by your zip code, which is of course dependent on what state that you're in. Another question that comes up regarding this topic is, what if you make a permanent move? If you move from one state to another state and this is a permanent move, how does this affect your insurance, and what steps do you need to take in this process? Now, in regards to a Medicare supplement policy, nothing needs to be done and your coverage will not change. A Medicare supplement policy is good in any part of the country. Whenever you move, you will need to notify Social Security of your new address, and then we will also ask you to update your address with the insurance company that is providing your Medicare supplement policy, but it will not change your benefits, and it will not change how the Medicare supplement policy works. It is possible that the new zip code for the company that you're with might actually be a more expensive, or it could be a less expensive premium. So that is something to consider if you're working with our agency. Whenever we do an annual review for you, we're going to take this into consideration, and we will make the best decision for you based on your new location, the different companies that are there, and what company is going to provide you with the best price at that location. Now, if you are talking about a Medicare Advantage plan or a Part D prescription drug plan, then notifying Social Security about your move is more important. It's good to give as much notice as possible, at least 30 days. If you contact the insurance company as well as Social Security and let them know that you're making a move, then the insurance company that is providing your prescription coverage, or if you have a Medicare Advantage plan, they will send you a letter confirming that you have notified them that you are moving, and this will be a letter that you can possibly use to get other insurance at your new location. This is referred to as a disenrollment letter, and this will allow you to get a new Part D prescription drug plan in your new location, as well as possibly get a new different but similar Medicare Advantage plan in your new location, or maybe even decide to change from a Medicare Advantage to a Medicare supplement plan when you get settled in your new location. I hope that the information in this video has been helpful. I know understanding and making the correct decisions when you may have some new experiences coming are a little bit frustrating, maybe confusing, and a little bit stressful. We would be very happy to work with you in any way to help you in the different decisions that might come up if you are considering a change in residence, or considering becoming a snowbird, or maybe an RVer. Our services to you are always free. We would certainly be very happy to look at the options available to you based upon your specific needs, where you're at now, where you might be going to. We can help you with the different steps in the process and make sure that everything gets taken care of without too much stress for you. I certainly do look forward to speaking with you in the future. I do indeed hope that you are having a great day. Thanks.